So perhaps women feel that they're afraid to go to the doctor to ask for help or for screening, or maybe they feel that, okay, this is normal. I feel tired, but it's normal. So perhaps those are the reasons. There's actually other reasons as well, but those are some of the reasons.
Well, are we seeing a trend whereby there's more patients now with this kind of issue, doctor? You see in your line of work?
Yeah, definitely.
Has it increased dramatically, or has it been like a slow, steady uptrend?
There is a slow, steady trend, but then there are studies that show that by 2040, there's chronic kidney disease is going to be one of the top causes of mortality in Malaysia. Yeah.
Wow, aside from diabetes.
Aside from diabetes and
My
hypertension,
goodness.
yes.
Okay, so once again, we are currently live in the studios of TRAXXfm. We're talking to a good doctor, Dr. Lilyany Farhana Aziz, a medical officer, and we're talking about women's health and kidney wellness, bridging gaps in care and awareness. So far, we've covered that women are more susceptible to this disease, kidney disease, due to a lot of factors, particularly when it comes to biology. And should you have any questions, head over to our, of course, TikTok account or even Facebook account at TRAXXfm Official. That's TRAXXfM OFFICIAL. Leave a comment in the comment section or just give me a call at 03-2282-5491 or 03-2282-4746. We're going to delve more into urinary tract infections and more on that, but we're going to take a short break right now and, of course, come back with a good doctor on today's topic. So stick around. Hope you're having a wonderful Tuesday, the 25th of March. And today we have a special guest in the studio. We're talking about women's health and kidney wellness, bridging gaps in care and awareness. We have Dr. Lilyany Farhana Aziz, a medical officer. And of course, once again, thank you so much for coming to the studio and answering a few of our questions over here. Now, we all know that women have different biological aspects as opposed to men, and women are more susceptible to diseases when it comes to kidney. And I just want to know, doctor, urinary tract infections, all right? Let's scare our listeners even further with this. The kidney infections, how do UTIs, that's urinary tract infections, and kidney infections actually impact women differently than men? And what preventative measures can women take to reduce their risk?
Thanks, Otto, for the question. So women are 30 more times prone to get UTIs. And the reason why they are more susceptible to it is because their urethra, which is the tract that comes from the bladder and to the outside of the body, it's very short. And of course, you would know that the man's urinary tract is a bit more longer. So when it's shorter, it's very easy for the bacteria to climb up.
Wow.
And yeah. And
I was thinking it's the other way around, but no, it's the other way around.
Well, it's also because there are other organs and
I see.
other features around that same area.
Mm-hmm.
And so that's why they're more prone to have it.
Okay.
Yeah.
Aside from that, pregnancy and kidney health. All right. So how does pregnancy affect kidney health, and particularly for women with pre-existing kidney conditions? What are the implications for both mother and child?
Pregnancy is awesome, but it also puts a lot of strain on your body. When you're pregnant, you have everything increases, your heart rate, your blood pressure. There's also more blood volume. So when you have more lead to failure more faster, you might have acute kidney injury. But then there's also those who don't have pre-existing kidney conditions, but they may develop hypertension or preeclampsia, which is a hypertension problem during pregnancy, and it can increase their risk of developing kidney problems in the future.
Wow.
Yeah.
And for women aged or probably after their menopause, let's talk about menopause and renal health. What are the potential impacts of menopause on kidney health? And how can women actually manage these changes effectively?
So as I was saying earlier, estrogen is a protective factor. So it's all about hormones. So before your menopause, you have a normal level of hormones, normal level of estrogen, so it protects your kidney. And so after menopause, then your ovaries start to shrink and you start to lose the function of the ovaries. So you lose that protective nature.
Mm-hmm.
And so you are also more prone to have kidney problems. And it's not just about kidney problems, but you're also prone to have diabetes, high blood pressure, cardiovascular disease, and these are all risk factors for developing kidney disease.
Mm-hmm.
Yeah.
Now, we're talking to Dr. Lilyany Farhana Aziz, a medical officer, talking about women's health and kidney wellness, bridging gaps in care and awareness. We're currently live as well on Facebook and TikTok. So if you want to say a big hello or probably just want to ask the good doctor some questions, leave a comment in the comment section or just give me a call at 03.
And it's also it depends on your body, because some people can take 2 cups of coffee, 3 cups of coffee.
Yeah.
But
It's strange.
of course you have to limit it. I think one cup of coffee is fine. And it really depends on how you react, your own body. So if you're already having a kidney problem, then you should probably cut down on your coffee and your caffeine. Not saying that if you're healthy, you can drink as much as you can. So
Exactly,
everything in moderation.
Yes.
And I just wanted to say something about what you were asking before. What kind of water to drink? Is it RO water?
Yes. Is it plain water? Is it mineral water? Or is it like a filtered water? What's the best for people having this condition or kidney issues?
As long as it's clean, filtered water, then that's good enough.
Boiled water?
Yeah, boiled water. Yeah, it really depends also where you are living. If you live in a in a community or in an area where there's less resources, you should not drink out of tap. You should try to boil it.
Yes.
If you are living in the city and you have access to filtered water, please do that. Of course, if you want to drink RO water, there's no harm.
Okay. So, point of fact here, just be hydrated whenever
Yeah.
you can. Yes,
Yes.
your body is telling you when to hydrate, so you must be well aware of the cues that your body is telling you. Another thing that we probably will get into is how to understand your body even better and know the signs before that. All right, so thank you so much for Najib Navi for that question. And remember to tap screen, guys, on our TikTok account. Show us some love and share it with your friends as well. And also for those who are on Facebook, do the same thing as well. Yeah, we're going to take a short break and be back with the good doctor right here on TRAXXfm. Eric Clapton, wonderful tonight right here on TRAXXfm's W Talk with a special guest in the studio. We have Dr. Lilyany Farhana Aziz, a medical officer, when talking about women's health and kidney wellness. Once again, thank you so much, Doctor, for being here in the studio and answering some of our questions from TikTok and also Facebook. So once again, Doctor, when it comes to this, let's talk about stress management for kidney health. Now, how does chronic stress affect kidney function, and what stress management techniques can actually help mitigate these effects?
Stress affects every aspect of your health, not just your kidneys, but your blood pressure,
Yeah.
Your diabetes, your sugar goes everywhere.
Yeah.
So when you have stress, of course, it would naturally affect your kidney. And if you already have a kidney problem, it can lead to worsening of the kidney function. And how to resolve.
Yeah.
You will never get rid of stress in your life, but you can try to improve it.
Ooh.
You can have like regular exercise.
Okay.
Course,
Exercising.
Do you do any exercise?
I do.
Yeah.
Yeah.
Okay. So regular exercise, eat healthy.
Yes.
So when you're stressed out, you don't go towards like
Sugary products and all that.
Yeah.
None of carbs and all that too much. Yeah.
And also, don't go towards
Coffee.
drinking alcohol or smoking.
Okay.
You try to reduce it in a more healthier way, of course.
Mm-hmm.
Mindfulness.
Yeah.
And making sure that you have support from your family, from your colleagues. So those are all important factors to reduce your stress.
So if your boss is giving you too much stress, you should get away from office and start eating healthy and clean.
Exactly. Yes.
Not complaining. Don't waste your energy on complaining and all that, but rather focus your energy on what should I eat today.
Yeah.
When you're too much stressed.
Yeah.
Okay. Thank you so much, doctor, for that. Okay. When it comes to impact of CKD on fertility, how does CKD actually affect fertility in a woman, and what options are available for those seeking to conceive while managing kidney disease?
Yeah. So it does when you have a kidney disease, it does affect your health, your health, of course, and it makes it a bit harder to conceive. It doesn't mean you should not try to have a baby, or you should avoid pregnancy at all costs. No, that's not how it goes. So if you are pregnant and you do have a kidney problem, it's important that you have a lot of planning. You should have some a lot of conversations with your obstetrician, with your nephrologist, because you have to make sure that your body is healthy enough to go through the pregnancy. As I was saying, that pregnancy actually it puts a lot of stress on your body, right? And it puts a lot of stress on your kidneys. Also, women who have menopause earlier, which means like before they're 45 years old, they are also more prone to develop. They're also more at risk of developing kidney disease.
Yep.
Because as I mentioned before, there's that hormonal protection of estrogen.
Yes.
And of course, if you do have kidney problems, then your fertility may be affected.
Now, what role can advocacy and also awareness play in addressing the gender gap in healthcare research and funding, particularly for women's renal health issues?
So interestingly, that there's not enough research on, particularly on women and kidney disease. So it's important that through advocacy and that we realize that we have to recognize that kidney disease is a major non-communicable disease, especially in women. And also we need to do more research on how to close that gender gap.
Mm-hmm.
Because as I mentioned, there's more women that have chronic kidney disease, but more men are receiving the treatment. And also it's important to collaborate with different entities. So it's not just the government in Malaysia, the government who's providing healthcare, but we also have to collaborate with other NGOs, other foundations that can help to provide, education and also services for kidney health.
Definitely, we're going to get in touch with you for more, awareness on kidney diseases or CKD, chronic kidney deficiencies, diseases. But when it comes to global initiatives for women's health, can you actually highlight any recent initiatives aimed at improving health for women?
Yes, as I mentioned, there was we need to promote more gender equity.
Okay.
Yeah. So we wonder why there's this health-seeking behavior is different between women and men. So I don't know. Is it because men are generally the the breadwinner. So if they have kidney problems and if they need to have renal replacement therapy, then it really affects the whole family. So that's why women have that, they take a step back. So it's important that this has to be addressed in...
could it be due that there's lack of research on it and probably awareness on it, which is why it's like kind of in a down low as opposed to men?
Yeah, so especially research that's unique to women, women and kidney problems, and also not just focusing on reproduction, but also focused on pregnancy as well.
Wow. Now, we're talking to Dr. Lilyany Farhana Aziz, medical officer, and we're talking about women's health and kidney wellness, bridging gaps in care and awareness. So once again, before we end, if you have any questions, please post it on our Facebook account or probably TikTok at TRAXXfm Official. That's TRAXXfm OFFICIAL. Or just give me a call at 0322825491 or 0322824746. Now, we're seeing a steady trend, an uptrend in terms of kidney CKD, that's chronic kidney disease, in our Malaysians, so which is why it is very important for you to take care of your kidney. Now, before we end, doctor, is there any advice that you give when it comes to eating clean to make sure that your kidney is on point?
Cut down your salt, please. Drink a lot of water. Please don't start smoking. Don't drink alcohol. Be happy.
It's easier said than done, but yeah, okay, carry on, doctor. Yeah.
Stay happy.
Stay happy. All right, find jokes. Yeah.
Yes, and and just be mindful of what you're eating all the time.
Exactly.
Yeah.
There are many foods out there that contain a lot of chemicals that might be very bad for your body. So make sure that you find the ingredients and look at the fine print over there before you consume it. Or just eat clean, just like what I do. Just take the salad without the dressing. Just eat tomato as it is. Or, rather than taking those chili sauce, you take chili flakes, those kind of stuff. So eating clean is very essential when it comes to your kidney, because your kidney is working 24/7 just like your heart, and it can go off in a snap. So please, we already have a lot of infectious diseases and a lot of issues in health, and a lot of people are going to hospitals because of these issues. It's all because of not eating healthy or eating clean. So do your best in making sure that your body is on point. So thank you so much, doctor, for coming to the studio. It's been a pleasure.
Otto. Thank you.
And I look forward to having more awareness campaigns from your side as well.
Yes.
So yeah,
That's
thank
a
you
good
so
idea.
much. All right, so we're going to take a break, and then we'll have the news at the top of the hour. For now, here's George Michael, Careless Whisper.